Hey everyone, I'm back again, and today's video is discussing how to fix neuropathy. If you're like many of those that I work with on a daily basis and have pain, numbness, tingling, or other symptoms in your feet or your hands, well, this video should be particularly effective in treating those symptoms and improving your life. So to begin, what is neuropathy? Neuropathy, or sometimes called peripheral neuropathy, is disease which is characterized by damage to the nerves. The peripheral nerves, meaning nerves that are not related to the brain or the spinal cord. The main types of neuropathy that I treat in my practice relate to diabetes, older age, chemotherapy-related, or trauma-related causes of neuropathy, all of which can be treated with the use of today's lesson, the bean box. So the bean box that I'm using today, I just measured, is 32 inches long, 16 inches wide, and only 6 inches tall. When using the bean box, the first step is to assume a seated position and be upright and tall. Then place the feet, without any shoes or socks on, into the beans. Following that, you want to perform different movements, the first of which are referred to as the windshield wiper. So just off and on. You can gather the beans over the feet if you'd like to keep them more submerged. I have found in my practice that the more submerged the feet remain, usually the more benefit one will receive. Second exercise is using the balls of your feet to scoop together a mountain with the beans. Try to bring them all together. The next exercise is to push those beans back out. Again, to push those beans back out. Okay, then we do the opposite using the heels. So first, scooting together a mountain. Okay, and then pushing the mountain back out. Movements that can be done in this position involve hip abduction. We're going straight to the side, and then hip adduction. We're adding to the body, coming together. So again, out and back, out and back. The final movement involves rotating the bean box and performing what I refer to as a shuffle. Shuffling back and forth, and back and forth. What you're going to need for this program is a large plastic box and about 25 pounds of pinto beans. The box I commonly refer to as an under-the-bed storage device tends to be the right shape. Pinto beans are usually chosen because they're cheap and easy to find and don't have any sharp edges. How to heal the neuropathy is essentially to provide a sensory stimulus to the nerves which are affected in giving you these symptoms. Again, it's most commonly found in the feet, but the hands are often an issue as well, and you can create two separate boxes. So in terms of dosage of the exercises, first I'd recommend to practice the different exercises as outlined in this video and see what's working for you. After that, you want to use the bean box for 10 minutes, rotating through each exercise that works for you at 1 minute apiece for a total of 10 minutes. At first, your endurance may be limited, and that's perfectly fine, but after you've been using it for a while, try to build up your endurance so that you can move through the whole 10 minutes continuously. So there is a second benefit to the use of the beanbox other than treating neuropathy, and that is ankle strengthening. Talking about fall prevention and balance improvement, one of the main ways that we prevent falls is referred to as the ankle strategy. The beanbox, being a multi-directional exercise tool, can be very effective for ankle strengthening, thereby improving the ankle strategy and helping to improve one's balance and decrease fall risk. Similar to how medications are often taken in a prolonged manner to manage symptoms, is very similar to the use of the beanbox. Neuropathy is a condition that unfortunately may resurface down the road unless you continue with the use of the beanbox. So this video has been all about treating the symptoms of neuropathy, but there is an almost endless list of topics I could post about, and a lot of that will depend upon what you guys want to see. So please post your comments below and subscribe so I can create a meaningful video for you. This is Dr. John Mayo, physical therapist, hoping that this program has been very beneficial to you or a loved one and helps to improve quality of life.